We fought hard for the last 16 years to fortify and have a very robust AIDS drug assistance program. We have kept people in the workplace. They have been productive tax-paying citizens. They have stayed off of Medicaid. And that is exactly how this program was designed. And because of the downturn in the economy, we are experiencing exponential growth at the base of this program. 105 new people are applying for ADAP every month because they're losing their jobs and they're losing their insurance.
Right now and last year is a 77% decrease for our agency. It laid 6 of our staff, of our 8 staff, off who could not find gainful employment in Northern Illinois because of a rising unemployment rate. So they can't find jobs. They're still with me, providing services that we really need to provide continuously. For this year, we'll be closing by July because we do not have adequate funding. The state is still behind on paying us for services provided in 2009.
If you cut HIV prevention and you cut ADAP, you're going to have people who otherwise could be working and paying taxes, having to stay home and be sick. You're having people who are going to lose their lives because they can't afford very basic medications. You're going to have people in our emergency rooms getting health care at the highest end cost of the spectrum as opposed to the lowest end cost. And it's a proven fact that without prevention, we're going to have more cases of HIV we're going to have to deal with in future years. So I think all of us, as we make these tough decisions, are going to say, we need to put our dollars where there's a return on our investment in lives saved, in lives improved, and a better quality of life for the people of this state.
I've gone through a lot in my life. And I'm also a formerly homeless person. I've battled several. I've had several emergency room visits, numerous prison incarcerations, and the only way I was able to turn my life around with it was only with the help of the AIDS Drug Assistance Program.
The fact that the AIDS Drug Assistance Program has kept people in the workplace, kept them healthy, and it is testament to the success of the program. Withdrawing any of the provisions of the program right now would literally be a death sentence to its clients, and that is nothing that's going to happen on any of these legislators' watch. I just know it.